Hello, everyone. Welcome to our maiden edition of Psychotherapy Voices. I am here. My name is Gloria, and I have my friend here, Joella, and also Eunice. Can they say hi? Say hi to
Hi,
the audience.
everyone.
Hello, nice to meet all of you.
So, in this session, we're going to talk about psychotherapists. People are just so confused about the role of non-psychotherapists, their scope and their limitations, and what they can actually do. So today we want to talk about all those. So please listen and feel comfortable to send us your email to ask any question you have in mind. The first question I have is going to Joella. What is psychotherapy? Let's start from there.
Psychotherapy is the act of talking about your thoughts, your feelings, and life challenges with someone who's trained to help you in a safe location. It's not about being broken per se, it's about understanding yourself better. It's about working through difficult emotions and learning healthier way to cope. You talk and a therapist will listen, and together you explore patterns, beliefs, experiences that shape how you feel and how you act. It's like having a guide for your emotional world and someone who helps you to connect the dots so that you can move together if forward in clarity.
Thank you so much for that description because I know there are so many people out there who do not know what nurse psychotherapists actually do. So thank you so much. And over to Eunice now. A nurse psychotherapist, or rather, who is a nurse psychotherapist?
That's a great question, Gloria. Psychotherapy is an RN or LPN or registered psychiatric nurse with additional training in mental health, equipped to help people through their healing journey, whether they are dealing with stress or anxiety or other mental health issues. And some of us, we dive into relationship dynamics and all of that. So the list is endless. So we are trained, especially in mental health, to help our clients.
Thank you very much. I know in Canada there's so much question. People are wondering, are nurse psychotherapists actually certified to practice in Canada? So Joella, I want you to answer that. Are they certified to practice actively in Canada or not?
The answer is yes. We are absolutely certified to practice in Canada. We are, as Eunice said, registered nurses, registered psychiatric nurses, licensed practical nurses, or nurse practitioners. We've completed that program and then have advanced training, and we are to follow our provincial college guidelines and rules and act within that scope of practice. And we have the ability to work as a group or as independent practice, and just making sure that we maintain our practice within the provincial standards.
Thanks for your answer. It's
Hmm.
very true because psychotherapy is a control art. So unless you have that additional training, even though you're a nurse, you cannot practice psychotherapy. So we as nurse psychotherapists, apart from our basic nursing training, we've gone ahead to do additional training that helps us to become nurse psychotherapists now. Thank you very much.
Hmm.
To Eunice, now, what can nurse psychotherapists do?
So many things. We do so many things. We do a lot of assessment. We provide counseling, talk therapy. We provide psychotherapy, which is the use of modalities to help people to heal depending on what they are dealing with. Some psychotherapies, they use CBT, cognitive behavioral therapy. Some use DBT, some use EMDR. I'm an EMDR therapist. I use EMDR, which is high movement desensitization and reprocessing to help people process their trauma. We help clients set goals and build coping skills. There are so many strategies and tools that we incorporate into our practice to help our clients cope with their emotional regulation and stress. That's two out of so many things that people come to therapy for. So we work independently. The three of us are in the independent practice here in Saskatchewan. We collaborate with other healthcare providers to make sure our clients receive optimal care that they deserve.
Well, thank you so much. As you mentioned, I see that we cover such a wide scope. Nurse psychotherapists are covering so much, but it's not surprising to me because of our background. Her background makes it easy for us to identify with clients in all walks of life to help them in their healing journey. So can you elaborate more on to Joella now, can you elaborate more on the scope of practice of nurse psychotherapist?
So we focus on mental and emotional health. Our big part is listening and supporting our clients. We help to teach coping skills and help clients understand how their thoughts and their feelings intermix. We use guided trauma healing, support addiction recovery, provide culturally safe and spiritually sensitive care, um, to have a complete whole body, whole person um, practice. We're not just looking at one little area of the person. We want to look at the whole person and help them heal completely.
Thank you for that word. Heal completely is the word. As nurses, we don't just look at the physical domain, we look at the whole three-dimensional aspect of a man. So that when healing comes, you are healed in every aspect of your life, not just in one aspect of life. So that's what we do as nurse psychotherapists, which is amazing.
Mhm.
And Eunice, can you tell us how are nurse psychotherapists different from other therapists? And what are the advantages of seeing a nurse psychotherapist?
There are so many advantages of seeing a nurse psychotherapist. Number one, we have nursing background. So we've gone to school, we have nursing degrees, and we now take it even further into mental health with additional training. So we, like Joella said, we look at the total being. We use holistic approach. We look at the mind, the body, and also the emotions. We provide warm and supportive environment for our clients. We are trauma-informed therapists. Working with us mean we decrease the wait times, you know. Uh, we are skilled in counseling and health education. We have so much to offer. We also help with noticing those physical symptoms early enough. There is the prevention piece. Prevention is cheaper and it's better than cure. So we are able to identify even physical ailments before they escalate, before they get worse. We don't want it to get to deteriorate. So we look at the total person, spirit, soul, and body. Yeah.
I think too, Eunice, it's important to mention that we work in conjunction with other healthcare providers if and when that's needed.
Thank you.
Yeah, absolutely. Absolutely. So we don't just wear one hat and say it's one size fits all. When we see clients, if they need to go talk to a pharmacist, we direct them to pharmacists. We send them back to their family doctor. Some family doctors even refer clients to us.
It
So we
was
send them
too.
back. We've done our part. So now go back to your doctor for your medication adjustments or whatever they need from their family doctor. We refer to dietitians.
Mm,
Yeah.
yeah. Even
Yes.
occupational health therapists and
Yes.
physiotherapists,
Yeah.
speech therapists, we can make that connection as a result of our background as nurses. And as nurses, we are also patient advocates. It's
Mhm.
because of that advocacy aspect of our lives that we can now tell a client, oh, this is where my services stop. I can link you up to somebody that can better meet your needs. Thank you.
Or we can even continue to see you concurrently. So you can continue to see a physiotherapist or occupational therapist or a dietitian and
Mhm.
come for psychotherapy.
Yes, yes, that's true. We can see client concurrently because when they are done with the physical aspect, they send them back to us. So we just work together, and all is to ensure that the client who is at the center of the care gets the best of services.
Mhm.
So over to you, Joella. Can you tell us what problems can nurse psychotherapists help with? People are always wondering, or can I go to them if I have problem eating disorder, or can I just go to a psychiatrist? They are just very confused about our role. So can you please tell us what problems can the nurse psychotherapist help with?
Absolutely, Glory. I think that because our role is newer, especially in our province, in our city, people are confused and they don't know what they can come and see us for. But we have a very wide range, even just amongst the three of us. Our skill set is very wide. Um, Stress and anxiety and depression is one. Trauma and PTSD, there's addiction and substance use disorders, relationship and family challenges. There's grief, bereavement, loss, workplace stress, life changes, whatever that might be. It might be loss of a job, moving. Maybe it's your kids moving out. Maybe it's your parents moving back in with you in this day and age of things are just changing
Uh,
all the time.
okay.
Immigration can be part of it. We have lots of newcomers to Canada and to our city. Um, that's a huge life change. And then there's also mental health screening and counseling. And that's just to name a few. Um, there's eating disorders, there's all kinds of things. And we're happy to chat with you and do those assessments. And, if it's not within our skill set, find somebody who is able to help you. And I think that is the biggest reason why people should come and see us because we can,
Yes.
if we can't help you, we will absolutely do our best to get you to somebody who can give you the best care.
Thank you so much. I like what you just mentioned because we are also nurse navigators. We
Hmm.
know the system very well. We know the health system very well. So if there's something we can't help you with, we know exactly who to refer you to. So that's why you have to come to us. Thank you for that.
Hmm.
So the next thing I want to ask is over to you, Eunice. As nurse psychotherapist, are the services confidential? People want to know. When they come to see us in therapy, are the services confidential or not?
Absolutely. So whether I'm a nurse clinician or a nurse psychotherapist, my services are confidential. So our services are confidential. What we talk about in the therapy room stays in the therapy room. There are exceptions, though.
Yeah.
If someone is in danger, if you, as a client listening to us, watching us now, you come to us and we realize that you are in danger or somebody else is in danger, we have that obligation to protect you and to protect the general public. So then we have to take necessary measures to make sure you are safe. It could be we might have to contact authorities to make sure you are protected. If we are being called by the court to come and testify, we also go because we have to obey the law, we have to obey the court. But then we give them what they need for the case at hand. We don't go there and discuss all the confidential stuff that we discuss in session, but we give them what they need for the injunction or the case going on. So your privacy and then your privacy is of utmost importance to us. Yeah.
Yeah, in addition to what Eunice just said, apart from you being in danger, if another person is in danger as a result of what you've mentioned, we also have the obligation to take that up. We won't close our mouth. So it's either you're in danger or you want to hurt somebody, another person is in danger. We have the obligation to alert the authorities because we want to preserve life. So thank you so much. And to Noella, I have this other question for you. Do nurse psychotherapists collaborate with other health professionals?
I think that we've mentioned um, that we are in the area of helping people, and helping people absolutely is not a one-man show. We must work in collaboration with other healthcare professionals, whether that's doctors, psychiatrists, psychologists, um, occupational therapists, uh, dietitian, whoever that may be, to get you the proper care. That's who we're going to reach out to. So yes, our collaboration is something that we use daily, and
Yeah.
knowing people and knowing services in the city and in the province is very important to us.
Yeah, the backbone of healthcare is collaboration. We can't
Hmm.
do without it every day of our lives. And it is so important to us because we can't do it all, like she mentions. So wherever we feel the need to direct you or refer you to a specialist, we do that because your care is the most important thing. Over to the next question. So many people, especially now that money is hard to come by, and people are just wondering, oh, I don't have money to go and see a therapist, and it is not free. So I just want to ask you, Eunice, do insurance companies cover nurse psychotherapy services?
Some insurance companies cover nurse psychotherapy services, and some don't. So we are using this medium to appeal to employers and insurance companies to include nurse psychotherapists on their list of mental health providers to reduce wait times, because some people, they have been waiting and waiting to see some of other
Yeah.
professionals that are covered under the insurance. So to reduce the wait list, we ask that insurance companies that don't have no psychotherapists on their list now to do so, so we can serve more people. And on top of that, some therapists do have what we call sliding scale for people who may not have insurance and cannot afford to pay out of pockets. So you can uh, reach out to us. We offer sliding scale.
Thank you so much. Joella, is there anything you want to add to that? Especially
I
in times
yeah,
like this.
I money is tight, and getting help shouldn't be
Mhm.
dependent on whether we can afford it. And like Una said, things are covered, some things aren't covered. It's important to keep those receipts from your appointments. Save it for tax time. Uh, everybody's different on how much they need before they can claim, but it's something to keep track of. It's not in your pocket right away, but at tax time you can get that money back, or a portion.
Thank you very much for that. But I just want to say, don't allow money to hinder you from
Mm.
accessing the care you need. Your mental health is very important, especially these days that life is tough. There's so much pressure at work, at home, in everywhere. So your mental health is very important. Don't allow money to be an hindrance. If you don't have enough, like Eunice mentioned, we have sliding scale. Just call and discuss with us, and we can tell you what we can do for you. So we are rounding up. As I just want to ask the last question. why choose a nurse psychotherapist? Can you tell our audience why they need nurse psychotherapists to see them?
There are
Uh,
so many reasons
Mm.
why people need to see a nurse psychotherapist. Everything we've been talking about, our nursing background, and extensive training in mental health. We help people navigate healthcare system. We are nurse navigators too. We wear their hat. We know where to point you, even if you need help in the community
Mhm.
or to navigate healthcare generally. And also the mental health piece. We are trained in CBT, some do DBT, some of us do EMDR, and we also provide holistic care. We don't only look at your mental health, we also help you with your physical health, your emotional health, your spiritual health as well. And we are registered, we are regulated professionals,
Yes.
and in this province, we are registered nurses of the province of Saskatchewan. Yeah.
Thank you very much. Joella?
we are nurses and we care about people. And I think that caring about people is uh, it's huge. And caring about people and their mental well-being is so important. And I think that points you towards a nurse psychotherapist, because we do care about people and we care about each of our clients and their well-being.
Thank you so much to both of you. And I just want to say, yeah, nurses, we wear so many hats. And because even if we can't help you, we are there to advocate for your needs. We are there to advocate for your needs, especially
Hmm.
mental health needs. So even if there are some extent we can't, we always refer you to where you can get the right care that you want. So that is it. Just at the end of this session, we're going to post our information and our practices. You can reach out to us, email, phone number, website, whatever it is. Just let us know. We have years of experience behind us that will help us to be better navigators for you in your healing journey. So, in closing, I just want to say that nurse psychotherapists, we bring a strong background in nursing. We have a nursing background knowledge, counseling skills, and psychotherapy, and provide whole person care. So, our voices matter in shaping the mental health services in Canada as a whole. So this guide will support learning, conversation, and community awareness. So thank you very much. Reach out to us. And now we want to introduce ourselves to you to tell you about our practice and where you can get us. So I will start with Joella. Can you tell us a little bit about your practice, where people can get in touch with you and your website and everything? Okay. We can see
Oh,
your website.
there.
Can you tell us a little bit about what you do?
Absolutely. So my practice is a chair at the table counseling services. I focus on stress and burnout, chronic illness and cancer, caregiver fatigue, whether that be caring for a loved one or in the foster community or kinship families, also grief and loss. Those are my little areas that I work within. You can see my website is there on the screen and my phone number. Feel free to contact me. I would love to have a chat and see if I would be the right fit for you.
Thank you, Joella. Thank you so
You're
much. So,
welcome.
our audience there, you can reach out to Joella at any time with the link that she has provided. So, now I'll go over to Eunice to tell us about her practice.
Hello again. I am Eunice, the clinical director at Biocounseling Services. I see people with trauma. I do couples therapy. I see families. I help people in their relationships generally. I see clergy. Um, I support women in their health. I accept insurance. I provide the 15 minutes free consultation because it's not every therapist that will be a good fit for every client. So I give that opportunity for people to connect with me for 15 to 20 minutes to determine if I am a good fit for them. So if you want to work with me, give me a call or send an email. All appointments are also bookable on my website. I have limited spots, but if you feel you want to work with me, go to my website and book a spot for your free consultation.
Thank you, Eunice. And all the information are there on the website. So please make that call. It's better to make that call today because some of us wait and wait till the situation deteriorates. But this is an opportunity to reach out to us. We can help you in any way we can. So we're going to move over to the next person, and the next person is actually me. My name is Glory. I'm the director of Zenvera Health Services. We offer psychotherapy, coaching, and consulting. And I focus on substance use disorder, generational trauma, BIPOC, and immigration support. And I just want to say that there's so much going on as immigrants coming here, cultural shock. There's so many things that add a lot of stress. So I help with the BIPOC community, the minority group, vulnerable groups to help them to provide that support to help you integrate in the society and to be stabilized in every aspect of your life. There's so much happening in the world of substance use these days. So if you are having issues with substance use, you can call me. We can see how we can work together to help you overcome this. And to single parents out there, it's difficult. To raise a child with two parents is difficult, not to talk about one. So there are so many issues with single parenting. So on my coaching aspect, I have this program, a 6-week intensive single parenting program called the Solo Architect, to tell you that in the midst of all this running around every day in circles, you are not just running around, but you are building something. And with time, with the right tools, you are building a home with the right tools, you will see yourself achieving your purpose in life. So if you're a single parent out there, maybe you have a custody issue. So many of the children are taken away, but if you work with the right person and you have the right tools, you can gain your children back, even anger management. So these are the issues that I work with in my practice. And in my practice, when you come, I do a wellness check for you. I check your blood pressure, check your pulse, just to ensure that physically you're okay. We go to the mental talk. So, and I offer that 15-minute free consultation too for you to discuss with me to see if I'm the right fit for you or not. And I offer sliding scale. So let money not be a deterrent to your achieving, stability or mental wellness. So reach out to us. The information is there on the screen, and we are here to help you. So thank you everyone for this session, and you'll be hearing more from us. The Nurse Psychotherapy Voices, this is just the first edition. So reach out to us, send us email, send us, phone call. We are always here to help. So thank you till we see you in the next edition. I just want to say, love yourself, take care of yourself, and forgive others. Thank you. Eunice.
Bye, everyone.
Bye.
Bye-bye.
Mhm.